So today is the 2nd of April 2020. We're on lockdown day number 11 in the UK. So the total cases worldwide is now 900,306. The total number of deaths worldwide is 45,693. The total cases in the UK, I'm still yet to get a number on that because we haven't had the WHO updates as of yet. But I have managed to get a total death figure. So the new total deaths in the UK is 2,921. So it's obviously risen from yesterday, which I believe was around just shy of 1,800, if I'm correct. Let's just double check it. Yeah, so just shy of 1,800 yesterday. Today, the total deaths is 2,921. So obviously the number of deaths has quickly amassed as well. The total number of countries that are affected worldwide is 206. So literally every country or every territory on Earth is now affected. The numbers are picking up. We were sort of guesstimating that within the next week or 2 weeks it's going to reach 100,000, but it's 900,000 right now. And obviously from yesterday to today, it's come up around about 70,000. So I'm really strong in thinking that number is going to reach 1 million before the end of the week. What do you reckon?
Absolutely. I reckon I'll probably reach it in the next 2 days.
Yeah.
It should do, In terms of the cases and deaths for the United Kingdom, if you go on the dashboard, with the world map, it actually says the date of reporting, the 2nd of April. So it's
right. Okay.
It's got the figures on there. So confirmed cases for the UK, 29,478, and the total number of deaths are 2,532.
2,000?
532. These are just totals. There's
I got 2,921 off Sky News. I was just looking on Sky News a bit ago, and they said that the death count has now risen to 2,921.
What are they saying? Their sources?
I'll just have a look at the story now. It says, literally 20 past 8 today. So in England, 44 of the 561 people who died had no underlying health condition. So a lot of, literally 500 plus people have died with no existing health conditions. And it did say another 569 people have died, bringing the total number of deaths to 2,921. What I think is probably happening is they're probably trying to update it as soon as they can. But literally, this has been on here since 20 past 8, so just short of 20 minutes ago. So literally, the actual death toll is 2,921, which is quite surprising, to be fair, because this morning it was a lot lower than that. Do you know what I mean? Like, if you're looking at yesterday, it was 1,800.
I mean, it might be that they've inflated the numbers as well, or that their source might be incorrect. We don't know. We have to wait until this update comes out from WHO.
Yeah. Some of the more interesting stories of today, then. So we've got a 5-point coronavirus testing plan that is in the works, and they're looking to test 100,000 people a day by the end of April. That's obviously good news, but what are your thoughts on it?
Is it going to take too long? Still, even though the time frame that they've given, you're looking at the rate of infections.
Yeah.
Now it's rapidly approaching 100,000 a day. So it needs to be done as fast as possible. I mean, time's going to tell if it's fast enough or not.
Absolutely. Looking at another story then, so we've got the New York Governor that's basically put out a warning today saying that there's only 6 days of ventilators left. So what he's done is he's literally stockpiled all the medical equipment he's got, and he said it's only going to last another 6 days. Do you think that in their state that they're in now, they shouldn't be rejecting Chinese aid such as medicine and vital medical equipment? They shouldn't be rejecting it?
No, they shouldn't. I think, it's a situation now where everyone should just, take what they can get in terms of, when someone gives something to them. Not when obviously you've got a choice and, a selection, like all these panic buyers. Don't take what you can get then, but just
that's it.
When someone's handing stuff out.
Yeah, well, that's literally what he's saying. He's saying, look, if there are any businesses out there in America that can, produce to a mass scale what we need, please come forward. We'll pay you a premium rate and this and that. Yet China is still mass supplying a lot of the medical supplies and equipment that's needed, but nobody's willing to take it. Do you know what I mean? Like, for some reason, they're all thinking that it's going to be dodgy or substandard. And we've spoke about this before, but I don't know why they're rejecting China's offer of medical aid, because beggars can't be choosers. If you're put in a position like the US is at the moment, you shouldn't be picking and choosing, really. It's just equipment. You need it. Without it, you're not going to survive.
Exactly. I don't know where the heads are at.
Looking at a very similar spin to that story, then, a lot of the European hospitals are running short on supplies and coronavirus drugs, and they're saying that literally it's only going to last them another few days, and after that they'll have to start turning people away at the door. Do you know what I mean? So do you reckon that European hospitals and European countries should also be taking aid from China and other Eastern countries out there?
Yeah, they should be taking it from whoever can manufacture them. The fastest. Yeah. Obviously, China's capability to just keep, manufacturing these on a mass scale.
Yeah.
Is the perfect opportunity for all these other countries, but they're not taking it for whatever reason. The only outcome I can really see is that everyone who rejects it is going to experience like massive amounts of death. And the countries that do accept it, if there are any, or China at least, is going to experience the fewest deaths, because they're going to have all that equipment just lying around.
Absolutely. And one of the things that I want to pick up on, obviously they'll have a lot of equipment lying around. It'll just mean more for China in a sense. So they'll be able to, have a massive stockpile that they're able to run through over an extended period of time. As well as that, do you reckon that that China is like one of the main players at the moment on the world stage because of their capability to produce on a mass scale again?
Well, yeah. I mean, you can just look at the the kits that they're trying to give out to other countries, and the other countries are rejecting it. That's a big statement on its own. It's not like some country that's out of the way saying that, oh yeah, we can make as many as you need, but really they can't. So these other countries reject it. China being the supplier that it is, to practically the world. It's always going to stay on the world stage, for something like this when it comes to manufacturing.
Exactly. And I think that countries close to China, such as Pakistan, Afghanistan, as well as Japan, and obviously the South and North of Korea, do you reckon that they'll be quick to accept help from China? Because obviously, if the help's there, I mean, if I was a world leader, I would be willing to take all the help I can get. And the reason is, obviously, you don't want to see people in your nation die off just because of your, reluctant behaviour in terms of accepting aid from one of the main players.
Yeah, I mean, it's going to look really bad if that does happen, and it already is happening if you think about it.
Exactly.
It's not like nobody's died in any country. Since there will have been people that have died in America overnight. So based on that rejection, could those people have been tested a bit faster, or could there have been some kind of treatment? In the next 2 weeks, the same thing's going to happen again. And then you can say definitely, right, okay, if that person had been tested, then perhaps they could have been treated. Some measure could have been taken. To help prevent that outcome. I mean, if they've only got 6 days worth of supplies, that how they worked that out, 6 days based on the figures that we've got right now, because in the last 2 days it's jumped up again by 10,000. So it's going to reduce the amount of time you'll be able to use these supplies for. In the next 6 days it might have increased to the point where a week's worth of cases now is just 1 day's worth.
Yeah, exactly. That's what it could get to. Just in terms of like the capability of almost every country on Earth then, basically. So it doesn't take much to get like, you know, a mass number of 3D printers and start printing out all of the equipment that you need. Like we spoke about a little bit earlier. I think this week we spoke about how 3D printing of equipment could be the next step, in the recovery process for a lot of the countries. I mean, anybody in the world that has, you know, the access to, you know, 3D printers on a mass basis can definitely start printing out not ventilators, but they can start printing out face masks, you know, the plastic ones that go around your face. They can start doing all sorts just via 3D printing. Are you sort of confused as to why they haven't started that yet, or they haven't exhausted their resources in doing that yet?
Well, I think the desperation to just use 3D printers at the moment isn't really as high as the current need for just using the materials that are already present, you know, to make the things normally. It's almost as if, you know, the 3D printers, you know, obviously you can make certain things yourself, but then it's a bit of a tough one to describe.
Do you know what I'm thinking, right? Do you know if we made and we mass produced medical equipment, just speaking as a whole from all the countries and stuff, if we decided to mass produce medical equipment, you know, surgical equipment, things that would be needed in an apocalyptic event, right? Instead of mass producing guns and all of this sort of shit, do you reckon that we'd be better off now, and especially for the future as well? We'll be in better stead in the future if anything did happen again.
Well, it depends on what happens, because if there's like a world war, then the guns are going to be more useful, you know, for the people who've been manufacturing them. But then obviously if it's another pandemic, then, you know, face masks and medical equipment are going to be more important. It's just, you know, it's all dependent on what happens first. But, you know, in the meantime, obviously we're dealing with the problems that we've got right now. You know, there shouldn't really be any diplomatic, you know, or like, you know, tensions between countries. Like everyone should just be rushing to help each other out and help themselves out, you know, in the best way that they can, where they can. I mean, everyone seems to be cooperating, just about, you know, in terms of at least, you know, giving the figures, you know, to the WHO, and then, you know, everyone's, you know, trying to work on a cure, because it's infected every country now, you know, that's it, like, who hasn't got it?
Exactly. And, you know, like normally how we wrap it up and we normally give advice to just public, like the public viewers and stuff like that. What advice would you give to world leaders out there? Like, you know, in terms of cooperating better with each other and forgetting like past issues and stuff like that, and like trade wars, and forgetting all of that stuff and just focusing on one effort against this coronavirus.
Well, I'd say to world leaders that, you know, it's not your nation that matters now. You know, as like an individual, you know, country, you know, you've got to start treating humanity like your nation, because you've got a universal enemy.
Absolutely.
And it's on everybody's doorstep.
Fearless.